This segment of Live on Lakeside is sponsored by Akron Children's Hospital.
Welcome back. Time now 11:28. We've heard a lot in the news recently that opioid abuse is an epidemic affecting the lives of so many people, especially here in Northeast Ohio. Holly recently visited Akron Children's Hospital to hear about their new opioid program and what they're doing to make a difference when it comes to this issue. Take a look.
Opioid painkillers, they're commonly prescribed and have been over the years to patients as they recover from surgery to help them heal. But in recent days and years, there has been a lot of misuse with this. So the doctors at Akron Children's Hospital have examined this issue, and they are set to make a difference with how they're prescribing these medications. Joining me to talk about this today is Dr. Kerwin Jones. Thank you. This is so important, first of all.
Thank you for having us.
I mean, how did this whole decision come to be?
Well, while it's no secret, as you said, that the opioid epidemic is a major issue, a crisis, if you will, for our children and our patients in this healthcare industry. But I think the big thing that people don't understand is that while doctors are not responsible for this healthcare issue, they certainly play a role in this healthcare issue. And we therefore feel like we are responsible for understanding the prescribing patterns that we give for children, to really know a little bit more about how we give opioids to children.
So exactly what steps did you take to look into this issue?
We were actually part of a 4-hospital group that actually explored what our prescribing patterns were for children after orthopedic surgery. What we did is we actually accumulated data on what physicians were giving for different types of orthopedic procedures to their kids in their population. And from that data, we're able to see that there was tremendous variation, not only from institution to institution with respect to what they were giving patients, but variation also within each institution with respect to what we were giving patients. And it's not that doctors are bad people, it's just that we didn't really understand what are the standards of care. There really were no standards of care for these prescribing patterns.
Right. So then as a result of everything that you did, how has this affected how you are treating patients now?
Yeah, well, we actually did a little study ourselves. We took that data that we had and we came up with 4 classes of patients, 4 different types of procedures that patients would undergo that would dictate what type of narcotics that they got. In other words, patients that have procedures where they're minor, moderate, or major procedures based on the amount of pain that they would have afterwards were given varying different degrees of narcotics based on the predicted pain afterwards. And by doing that, we're able to standardize care for all of our patients in our institution.
Okay. What's been the result of this effort?
Yeah, well, the next step was we actually built this into our electronic medical record, because that way it almost forces the provider, the person giving the prescriptions, to write the correct prescription for the patient. And by doing so, we're able to actually achieve 90% compliance with these guidelines over 12 months of patient care.
It's amazing.
Yeah, I give credit to a lot of the physicians that actually stepped up to the plate and actually cared enough to make a difference and try to challenge the system. And in so doing, we found that we've decreased the use of our narcotics in this institution by over 40%.
Wow.
Yeah.
I applaud you. That's really great. So I'm curious, how has this caught on in other departments here?
Great question. Actually, we've been so successful in our orthopedic department that we now have initiative for all of the surgical subspecialties to develop their own pain guidelines by the end of 2019.
Wow. Is anyone else doing this in the area?
No, actually, nationally, there are no other pediatric hospitals that are actually doing the same sort of thing. And that's why these guidelines are actually published online on our National Pediatric Orthopedic website, so that other hospitals, other institutions can start utilizing these.
So Akron Children's Hospital could literally say we are the first ones that are doing this.
That is correct.
I mean, it's a fear, I think, of any parent in this day and age, for sure, because of everything that is going on with the opioid epidemic. So, you know, I'm a mom and I know it scares me to death. What should a parent know if their children are indeed prescribed these medications?
I think one of the most important things to understand is that they need to question their doctors. They need to ask the question, does this child really need narcotics? Or if they need narcotics, are there other alternatives that they can use to supplement the narcotics? Simple things such as acetaminophen or Tylenol, things like ibuprofen, and there's a lot of medications that Aleve and whatnot. ice, elevation, simple things that they can do to alleviate pain that aren't necessarily narcotics.
Yeah, conversations that are super important to have.
Yes, for sure.
All right, keep on doing what you're doing, doctor. Thank you again
Great,
for talking
thanks.
to us.
Thank you.